Welcome to Breaking the Silence, a podcast produced by Angels Protection, Inc., where we amplify the voices that challenge inequity, advance healing, and reimagine leadership in the way that systems shape our health and well being. I'm your host, Makaila Davis, founder and chairwoman of Angels Protection, Inc., and in today's episode is a part of our Men in Medicine series where we spotlight physicians whose leadership extends beyond clinical care, men who are advancing innovation, compassion, and systems level change in healthcare. This series exists because representation in medicine matters, because how physicians lead influences how patients experience care, because medicine is not only about diagnosing illness, it's about restoring dignity, trust, humanity, and patient experience. This conversation is more than medicine. It's about purpose. It's about leadership. It's about what it truly means to carry the weight of caring for others. And today's guest embodies that truth. Dr. Richard Harris is a board certified internal medicine physician and pharmacist whose work bridges clinical medicine, personalized care, and healthcare leadership. He currently serves as Chief Medical Officer for Nimbus Healthcare and Script Health, where he helps guide patient-centered healthcare strategies that prioritize personalized medicine, prevention, and relationship-driven care. Dr. Harris brings a unique perspective to modern medicine through his dual training in pharmacy and internal medicine, allowing him to approach patient care with a comprehensive understanding of treatment, medication management, and long-term health outcomes. At the center of his work, client-centric philosophy, one that focuses on building meaningful relationships with patients and designing personalized treatment plans that address the whole person, not just a diagnosis. Beyond his clinical leadership, Dr. Harris is also the author of the Amazon best-selling memoir, White Coat, Heavy Soul, a powerful reflection of the emotional realities of practicing medicine and the unforeseen burdens physicians often carry while caring for others. Through storytelling, advocacy, and mentorship, Dr. Harris continues to shift conversations around physician wellness, medical culture, and humanity beyond the white coat. He has been a guest speaker at national healthcare conferences and served on advisory boards alongside leading voices in healthcare innovation, contributing his perspective on patient-centered care and the evolving future of medicine. Outside of medicine, Dr. Harris enjoys reading, weightlifting, sports, traveling, philanthropy, church, and even video games, reminding us all that beyond every physician is a human being balancing purpose, passion, and personal well-being. What sets Dr. Harris apart is his willingness to speak openly about both the responsibility and the emotional weight of practicing medicine, helping redefine what compassionate leadership in healthcare can look like. And we are honored to welcome Dr. Richard Harris to Breaking the Silence.
Thank you so much for having me on the show. I really appreciate it.
No, thank you so much for being a part of it, for all the amazing work that you do. So, I kind of just wanted to start off by asking what first inspired you to pursue both pharmacy and medicine, and how did that dual background shape the physician you are today?
So, as a kid, I remember the first inclination to go into medicine was my mom handed me Gifted Hands by Ben Carson. And I read that book. And I remember I'd never seen a black doctor before. And his humble beginnings made me think that if he could do it, I could do it.
Mm.
And from that moment, I wanted to be in healthcare. It kind of went around in a circuitous journey. Every doctor I talked to said, don't become a doctor. So I got to college and was unsure. And then I went to pharmacy school because I worked in the dean of the pharmacy school's lab. And I told him I was about to graduate. I had no idea what I wanted to do. He said, come to pharmacy school. I think you'll make a good pharmacist. I never talked to pharmacists, didn't know what pharmacies were doing, had never been in a pharmacy. I just thought, okay, I trust this guy. I mean, he's the dean of the school. I've been working with him for 2 years. So he probably has a good read on my character. Maybe I will make a good pharmacist. Got in pharmacy school, loved what I was learning, realized in that first year, it's called the P1 year, that I was missing something. I loved learning how you treated things. I loved learning about pharmacology, but I didn't know how you diagnosed anything, and that bothered me. And so I decided that year that I was going to go to medical school, but I've never quit anything in my entire life. So I applied my last year of pharmacy school for medical school, deferred medical school a year, and then did medical school, internal medicine residency. To answer the second part of your question, it made me so much of a better physician because I understood proper patient selection, proper dosing, which medication to use in a class when there's, three, four, five different choices that you can use. Which one is the best for the person in front of me? I could better talk about adverse effects. I could better talk about what to expect, when to call me, when to talk to your pharmacist. How are we going to change things along the way? What are our other options besides medications? Are there supplements or are there lifestyle changes I could make in the meantime? So I was able to package all of that together to better serve my patients. And it really impacted the elderly patients because a lot of times they were on so many different medications that interacted with each other, and we were treating adverse effects of medications with medications. And I would do a lot of deprescribing. I'd pull people off 6 to 8 medications, and they felt better and they improved. And that was literally all I did. But that's because I understood the pharmacology and I asked questions. Why are you on this? How long have you been on this? Has anybody ever tried to take you off of this? What happens if you don't take this? What happens if you do take it? Right. And that investigational style came from being a pharmacist.
I love that. To me, and well, you know this too, you have a unmatched skill set because you have your pharmacy degree and medical. So, and most folks only have one, small percentage of folks that have both. So, and you being able to like pull from that, like you just said, is so critical, important, and you're able to have greater patient outcomes because of it. Um, so I also kind of wanted to tie into too, how can physicians move beyond transactional healthcare and build meaningful relationships with patients?
It's going to be really, really hard inside of the system. So when I was inside the conventional medicine system, I worked at a large primary care practice. I had over 1,000 patients. I think I had almost 1,200 patients on my panel that I was responsible for. And I would be booked, 2 to 3 weeks out. And every patient had 15 minutes, no matter what was going on. Sometimes they had 30. They could book an extended visit, but they had to pay more money for that. And it's really, really hard to figure out what's going on with that person in one visit. And then it was hard for them to get back in and see me. So I decided to create resources for patients. So I spent my own time outside of my busy work hours and created lots of documents for patients. I also started talking online, not, about individual patients, but about themes, things I repeatedly saw over and over again. Because I had this thought that we have to help people where they are, and people don't live inside your office. So we have to reach them with the right information at the right time. And how do I do that? Because I knew that most patients were going to forget what I talked about inside of the visit. Most patients don't come in there with a notebook to write stuff down. So that's why I created the resources, started talking about stuff online, pointing people to different resources for their issues, because that was the best that I could do inside of that system. Now, I'm really excited about the growth of things like direct primary care and concierge medicine. So there's a little difference between the two. Concierge medicine, you typically pay a yearly membership fee, and then they take your insurance. And the yearly membership fee is really just so they can keep the patient panels down and ensure that you get access to the doctor. The direct primary care is a monthly subscription for that doctor's services. And sometimes they include things like labs and even prescriptions in that service. So it's a one-stop shop. You know exactly what you're paying for those services that they offer. These are the types of medical interventions where insurance companies aren't telling you what to do. A lot of times, insurance companies dictate what I can and can't do. Nowadays, it's gotten ridiculous. I can't even order continuous glucose monitors for my patients with diabetes without getting a prior auth from the insurance company, right? And these are patients with diabetes. Imagine how tough it is in other conditions. So I'm excited about that model. The problem is that not as many people yet are willing to pay cash for services. But I think as insurance costs keep going up and up, more and more people are going to opt out of those services, especially when most people are just going to the primary care doctor, not going to a bunch of different specialists. So I think that's what we can really do as a profession is really advocate for the patients and advocate to take back our time to get to spend with patients, really dive into each individual and not do what I call fast food medicine, where it's just a conveyor belt. Get them in, get them out, get them in, get them out, refer them downstream so that the group that owns you and owns the specialist can now bill more for that specialist visit.
I agree, especially as you touched on fast food medicine in and out, because I know I could even speak for myself. My visits are very quick. And it's like, it's basically like, hi, here you go, da da da. and gone. Usually spend more time with the medical assistants or the nurses. Um, but I really love how you touched on that. And I also wanted to ask too, so your book, White Coat, Heavy Soul, speaks to the emotional and psychological weight physicians often carry. What inspired you to write it?
My wife, really, she was on me for years that I need to write a book. And when I finally did, well, number one, my wife is always right. So I knew I had to do that. It's just a matter of finding the time and then finding the story. And when our son was born, we had a traumatic birth. And I realized that talking to other people, so many other people had gone through similar experiences. We did IVF, we had an emergency C-section, our son was in the NICU. And I wanted to talk about that and that journey to help other people who have been through that not be afraid to share their story. But really, the book is just about my journey through medicine, some of the things we talked about today, and how I unshackled myself from what other people told me a doctor should be, what other people told me the practice of medicine was, and figuring out how do I want to practice medicine. The problem with being an internist is you're a generalist, and I would see everything. And I don't want to treat everything. Everything doesn't interest me and being blunt with myself that I don't like this. Maybe I don't want to treat this. What do I actually really like to treat? Like what gets me excited? And that was preventative health and metabolic health. These are my two favorite things to do. If I can prevent a disease, if I can say that, hey, you're at risk based upon these factors, these activities, these biometrics, here's what you can do to prevent that risk. Here's what you can do to prevent developing these conditions you're at risk for. That is really exciting to me. And then improving things like blood sugars and blood pressure and so on and so forth. So the book has so many different aims and it's written to so many different audiences. It's more about the human experience than it is about the science. And everybody's interacted with healthcare. So there's a portion of the book that everybody will resonate with. But I really wanted to paint a picture that whether you're a physician or you're a healthcare consumer, there are ways out there for you to interact with healthcare in the manner that fits with your ethos and what you want out of it.
I agree. And that kind of goes into my next question too, that I want to touch on. So, as your chief medical officer for Nimbus Healthcare and Script Health, how do you approach leadership in today's rapidly changing healthcare environment?
I think the most important thing is listening, and it's listening to what patients want. And
Mhm.
that should drive everything that we do. So Nimbus came out of a desire for patients to engage in personalized medicine. People were tired of cookie cutter prescriptions, cookie cutter diet plans, cookie cutter treatments, and they really wanted to be able to individualize and customize their treatment plans based upon what they want. And so that's where Nimbus came from. We own a compounding pharmacy, so we're able to tailor really specific and individualized doses for some of our protocols. We use genetics. It's a field called pharmacogenetics where you look at someone's DNA and that can predict how they may respond to one drug over another, or maybe certain vitamins or certain lifestyle patterns. And that's that personalized medicine. And I think that's something that more and more people are wanting. The other thing, script health, that came out of a need for pharmacists to intervene and be those community health hubs, right? We know 2030, 2034, we're going to be about 70,000 primary care physicians short in this country. 93% of Americans live within 5 miles of a pharmacy. Pharmacists and pharmacies are going to be the only source of healthcare in a lot of communities as that primary care gap continues to increase. And so patients were asking their pharmacists for these services, and that's where Script Health came from. So the number one principle I think in leadership is listening. Listen to your customers. Like really listen to your customers. Don't build what you think is cool, build what they want.
Mm.
And I think that's hard for founders to do because when most founders start off with a really cool idea and they want to build it and they lose track of what does that customer, what problem is that actually solving. And then listen to your people. So I'm really big on listening to the people who are on the front lines, the people who are interacting with the customers, the people who are making the prescriptions, the people who are interacting with our software. How are they using it? What things do they like? What do they not like? And tailoring things to their experience. And I think that's really essential nowadays because I feel like truly listening is a lost art. And then I would think the next most important thing is really caring about the growth and development of your people and really getting to know them, knowing what's going on, knowing their struggles, knowing what they want out of life, and really helping to develop those around you and realizing that that will help your company be a better company if you develop the people that you work with, the people that you lead. You know, I don't like to say that we manage our employees. I like to say that we lead our employees. And that starts with how I invest in myself and invest in them and knowing that they are cared for, that they are important to our goal, and that we wouldn't be there without them. So I use an example of this as every janitor I see, I thank for their hard work, right? Because I forget who said it, but if the CEO is missing from your company for 3 days, you're probably not going to notice. But if the janitor's missing for 3 days, you're definitely going to notice.
Yeah. Yeah. And I think that's a really great analogy too, because when you're so much at the top, and I think a lot of people aspire for leadership, but the more you go up at the top, the more far removed you are from the population at hand, and being involved in the day-to-day aspects of it. Unless you're a founder and it's still a startup, then you're involved. But as your team grows and expands, and you have funded positions, you become far removed. Um, so yeah, it's really important, like what you said, always thanking the janitor. And then I also wanted to touch on too, so why is it so important for physicians to maintain their humanity outside of their professional identity?
Oh, that's super important. This is something I learned in residency. I would see doctors still working at like 70. And at first my thought process was, oh, they must love what they do.
Mm.
And then you really take a look at their faces, and I realized they're not here because they love what they do. Some of them were. They're here because they have to be here, because this is their identity. They don't know anything else besides being a doctor. They gave literally everything they had to the profession. Some of these doctors, they didn't really know their families and they didn't have any other hobbies. So it was their identity and they couldn't see themselves as anything else but as a physician. So to me, working 16-hour days at 60, 70 years old sounds absolutely miserable. And I didn't want that. So I realized that in order to best serve my patients, I had to serve myself. And I had to still do the things that brought me joy outside of helping people. So that's why it was really important to me to maintain my hobbies and my interests outside of medicine. And then it also better allows you to connect with people. So when people tell me about their stories, I try to relate to my own personal stories. And if I didn't have hobbies and if I didn't have interest in certain areas, it would be really hard for me to relate to people and understand why something is important to somebody. So I think it is important to maintain who you are, work really hard to maintain who you are. Medical school and residency, it's really hard to do that because you're so busy. But I worked really, really hard to continue doing things, even if it was only an hour a week that brought me joy. And I still do that now by putting guardrails on my time and my capacity because they're two different things, right? Time and capacity are two different things, and that's something I had to learn the hard way. Even though I had time for something, I may not have the capacity for it. And that allows me to continue to have those things in my life that bring me joy, helps me refill my batteries so I can best serve our patients, best serve those in our company, and best serve my friends and whoever else interacts with me.
No, I appreciate that. And I think that could go for all folks that are pursuing higher educational terminal degrees, whether it's MD, PharmD, JD, PhD. Sometimes we do lose ourselves in that process as we're just like, oh, I need to get this degree. I need to just finish it, finish it, finish it. I need to do full-time school. I can't take part-time classes. I need to get it done, be on time, and that could cause burnout. So like you said, even if it's just 1 hour a week because your schedule just doesn't allow it because there's so many papers you may need to write, so many tests and exams that you need to study for, and make sure that you're there on class on time. So even it's hour, always making time for yourself and things that you love for yourself. Um, and also, too, I wanted to ask, what advice would you give to students considering careers in medicine today?
I think medicine can still be a rewarding career. I think you can still carve out a niche for yourself and do incredible, amazing things for patients. It's just that you have to think outside the box and find your own path. And I think if you do that and are willing to do that, you can have a long, wonderful career in doing something that you love and enjoy every single day. I also would say that don't get isolated when you're going through school. Yes, the exams are important. Yes, your grades are important. But I'll tell you now, I don't remember a single exam that I can think of that made a really memorable impression on my life. But I remember trips from medical school that I took with my friends. I remember events that I went to, concerts that I went to with my friends in medical school, right? So 20 years down the line, that test that you were stressing about, you're not even going to remember. But if you take some time away and say, you know what, I need some time. I need some personal time. I need some time with my friends. Those nights you will remember. Those events you will remember. So reorient yourself on that. And we know that, things like exercise, things like social relationships are important for your brain health. So I looked at it like these things are important to do because they are what allows me to have the cognitive capacity that I need in order to do well in school. So that's my advice to students is sort of zoom out, look at things differently, continue doing things that are good for your brain, good for your overall health, and you'll do better in school if you have that balance.
I think that's really important as you touched on too, like balance and those tests that, you took years ago, you don't even remember, and you're not using it today in your practice. It's all based of the lived experience and everyday working environments that you're doing. And I also wanted to ask too, so when you reflect on your journey so far, what continues you to give hope about the future of healthcare?
I think it's the passion of the people that I encounter in multiple different areas of healthcare who really, really care and are really doing their best to advocate for their patients who also care about the profession and freeing up as many other individuals to practice on the terms that they want to practice on. So I've met so many different founders, whether they're companies or groups or programs who are doing that. And I think that's really, really cool because they're practitioners, but they're also helping other people practice on their own terms. And I think that's what's lost from medicine today. The docs in the 80s and 90s and early 2000s sold to companies. And I can't blame them because they got paid a lot of money, right? But that model of you're a young doctor, you come into a practice, when the older doctor retires, you buy the practice, that model doesn't exist anymore. So you have to really carve out your own space. And I think there's some people who are doing that. That's what really gives me hope about the future. I'm also really excited about what AI will do as far as preventative health and risk analysis and being able to piece together models for me to help my patients intervene on, and also helping with data aggregation. Because a lot of times when patients come to me, if they have 3 or 4 or 5 years of lab values, that's great because I can identify trends. I don't, if I have one lab value that's one time out of whack, is that a blip or is it a trend? And that's really, really hard to tell. But with AI, and what I'm hoping is patients get control of their data, the data goes with the patients. that will be able to help me do my job better in identifying these trends over time and how patients, an individual person has responded to certain therapies, whether it's diet, exercise, certain supplements, whatever it is.
No, I agree. And now for the million-dollar question, how can folks stay involved with you, with your projects, your programs, just all the work that you're doing, and get connected to you?
Yep, I'm really active on LinkedIn and Instagram. Those are my two most active projects. Dr. Harris MD on Instagram and just Dr. Richard Harris on LinkedIn. You can also connect with me on my website, drharrismd.com. That's a great way to connect with me, see my resources, see what I'm up to.
Perfect. So, guys, please get involved with him. He's doing amazing work within the community, from his books to the projects and programs to the two companies that he's leading and advising. So, please take advantage of that and utilize LinkedIn. Um, so now I just want to say, Dr. Harris, thank you so much for your commitment to patient care, physician wellness, and compassionate leadership in medicine. Your work reminds us that behind every diagnosis is a human story, and behind every physician is a human being carrying the responsibility of caring for others. Through your advocacy, storytelling, and leadership, you're continuing to help move medicine toward a future that values not only scientific excellence, but also empathy, trust, and humanity. And to our listeners, if today's conversation resonated with you, stay connected with Breaking the Science podcast and Angels Protection Inc. as we continue elevating voices that are transforming healthcare, leadership, and community systems. And always remember, science protects systems, not people. So let's keep breaking it together. And please like, comment, subscribe. Thank you, everyone. Take care.